Thank you. Luke Evans.
Thank you, Joe, and thank you, Sir Simon. I'm interested in the red tape and bureaucracy culture coming down from the top. Time is short, so if you could answer this question. In your previous jobs, you've seen a lot of different systems. On a scale of 0 to 10 when you came into the NHS, 10 being the most efficient and no red tape, and 0 being all red tape, what was your assessment at that time when you came in? Just a simple number.
Well, there are various ways of answering that question, aren't there? One is to ask the nurse on a ward, the junior doctor, how much of your time is spent patient-facing caring, and what those staff, of course, say is that actually a proportion of their working week is spent on data entry, medical records, and all the rest of it. So there's some of that. But by the way, that turns out to be an international phenomenon. That's not an NHS-specific phenomenon, I would say. And then on the overarching red tape, as it were, or our administrative costs, of course, they're very, very low. I mean, we spend about 2 pence on the pound on administration in this country compared to 5 pence and 6 pence in France and Germany, and way more than that across the Atlantic. So actually our on-costs, if you like, are very, very low.
So the reason I ask this is because I'm keen from the vaccinator is a good example. Frontline, when the vaccination program was brought in, there was 14 different pieces of information that someone needed to sign up, including manual handling, spotting potential sort of terrorist threats. Very quickly, the NHS acted, scrapped all that, and made it more streamlined. So that's due to the necessity of the pandemic. Thinking as we're looking for the future, what do you try and do as the leader of the NHS to install that kind of rapid response for when we're in peacetime, effectively? Because clearly the NHS can change. What are you doing to give it the chance to change?
Yeah, no, I agree with the point you just made, actually, Luke. So, I mean, look, on those requirements, they were streamlined very quickly. We had a very productive, or the Department of Health had a very productive conversation with the Home Office and said, actually, these prevent terrorism requirements, maybe they don't need to apply in this situation. We had a very good dialogue very quickly with the Care Quality Commission around some of the requirements that they would normally have, with the medical royal colleges, and so on and so forth. So, look, absolutely. And I think that has been the experience, and it's been pretty well recorded now across the health service, that when people just focus on the goal and then everything else is just a means to the end, and if it's not contributing, then you get rid of it. That is absolutely the essence that we want to continue with.
And how are you going to keep that spirit up?
Well, because I think that has turned out to be the sort of fuel in the tank of driving clinical change in all kinds of ways across the service, and people can see it's working and they want to sustain it. So, you know, when it comes to setting up home-based services, monitoring with pulse oximetry, oxygen. I mean, that's clinicians who have seen that, have had the ability to get on and innovate and then spread that across the service. When it comes to establishing new clinics for long COVID, say, where we've got over 60 and more opening, that began with clinicians in places like Leicester and Newcastle and University College Hospitals, identifying a problem, doing something about it. We then got NICE in to say, all right, what does this need to look like in a more standardized fashion? So that's the change model, and I think we want more of it.
So I'm really keen to hear that, because you, as the leader of the NHS at the moment, are going to come into the contact with almost the entire population of the UK for 15 minutes when they come in and have their jab. What plans are set in place to get opportunistic public health interventions like stopping smoking, obesity into those big centres? Because this is the one time that you may be able to contact people the NHS has never, ever been able to have contact with.
Yeah, that's a great point, actually, Luke. And obviously, just to clarify, the 15-minute wait is particularly for the Pfizer-BioNTech vaccine rather than for the Oxford-AstraZeneca vaccine. And I think that's an interesting observation, and I will put that to my colleagues and see what they come up with. But if you've got ideas in the meantime, please do so. I know that GPs locally, exactly in the spirit of this conversation, are themselves already taking this opportunity. And, frankly, down the line, I would hope that not only other opportunistic contact, as you described, but it would be great if COVID vaccine and flu vaccine ends up being combined into a single vaccine, which we might see for, if not this winter, then future winters as well. So I think there's a lot of opportunity.
That's really great. And I guess it's in the spirit of thinking what we can do better in the future when we do with it. And
yeah.
I don't expect you to give answers to us on this, but maybe just a commitment to the committee that you'd be happy to submit a plan towards us about how you are thinking about the big picture from the future of the best ideas that we can take forward would be very welcome.
Sure. And if in the meantime, if you have got particular ideas or the committee's got particular ideas on that as well, then I'd love to hear them. Definitely.
Thank you very much.